Hey, Roger, I'm 60 years old. I have this big old growth to my nose.
He ain't kidding.
They have little holes in it. That's where all the pus comes out.
Roger appears to have probably the most severe case of rhinophyma I've ever seen. Rhinophyma is a form of rosacea where you grow excess tissue, sebaceous type tissue, on the end of your nose. And I don't think I have ever seen one like this before.
And it's heavy. I can't breathe through my nose because of the heaviness.
I've got to estimate that that thing probably weighs at least 5 pounds, maybe up to 10. Can you imagine that hanging from the end of your nose? I mean, how long did it take for this to get to this point?
But I had this growth for about 11 years. It was just the size of a pimple.
That's the crazy thing about rhinophyma, is that often it starts very, very tiny and then it just kind of gradually, insidiously grows. And the question is at what point does somebody jump in and surgically reduce it?
And then it started bleeding and it started getting bigger and bigger.
Now, you may have seen cartoons of people in the past, back in the 30s and 40s and 50s, where they've got large red noses and it's associated with drinking alcohol. Well, that is a very loose association because drinking alcohol can be a trigger for rosacea, but it doesn't necessarily cause your nose to get larger like this.
I went to a couple of hospitals, but they didn't want to help me. They just said, since you didn't have no insurance or nothing, it's just like a hi, bye.
Now, this is just another sign of our broken healthcare system where a person like Roger would show up at a hospital which is required to treat people who are not insured, okay, and still get turned down for treatment.
There's a lot of things I can't do with this thing on. I have to move my nose because I can't eat right, because there's barely any room.
So if you have rosacea or if you have rhinophyma, how do you prevent it from getting to this point? Well, there are a lot of options. The first thing is with rosacea, you want to avoid the trigger. There are also a number of topical medications that can help with rosacea. Medications like Solantra can help reduce the symptoms of rosacea and may even help prevent rhinophyma from developing.
I can't breathe through my nose because of the heaviness. I have to breathe with my mouth. I have to lift this one up to breathe with my right side.
As a plastic surgeon who operates 3 days a week, I mean, the thought of just going in and lopping that off is such a satisfying thought.
Everybody laughs at me and I feel sad.
As a surgeon, this makes me sad because I know that there's such a very direct solution to his problem. So I'm really looking forward to seeing what Dr. Sandra Lee can do for him.
And Roger has the most extreme level of rhinophyma that I've ever seen. His situation is truly critical.
Because those masses are so severe, he has excoriation of parts of them, meaning that some parts of those masses don't have great blood supply, they get recurrent infections, it smells not so good, and that's one reason why you're seeing all those flies buzzing around it.
Because the main concern I have here is how it's occluding your nostrils and whether your nostrils, the cartilage is still patent.
The nasal cartilage is necessary to allow him to breathe through his nose. If that cartilage has been significantly damaged, it can really impact his actual airways. It is super important not to make that cartilage a part of the resection or of what they remove, because removing that can cause him to have horrible problems breathing.
His nostrils are stretched.
So it looks like he's going to need some type of nasal reconstruction surgery in addition to removal of these masses.
We know somehow we've got to get him under general anesthesia without having normal access to either his nose or his oral airway.
The important part of a general anesthesia is because you're completely out, you need something protecting your airway, allowing the air to go in and out of your lungs, and typically that's through some type of a tube that either goes through your nose or through your mouth. Well, you can't go through his nose because he's got that huge rhinophyma mass in the way, and to go through his mouth, the same problem is there. You've got that huge mass there.
A tracheostomy is not a simple process. The hole is created in your windpipe, and this may sound really extreme.
It makes sense that they're going to do a tracheostomy on him because the first thing is you want to make sure you have a good airway. And so basically making a hole in the neck and then putting the breathing tube down that hole to allow him to breathe is the most important part, potentially, of this operation.
Luckily, the tracheostomy worked, so Dr. Osborne and Dr. Hamilton can now continue with the procedure.
Performing a tracheostomy on somebody where you don't really have good access to the nose and the mouth is a huge challenge. So I really give props to those facial plastic surgeons that it went so smoothly.
So we've got a circumferential skin cut without too much blood loss. That's nice, but I can already see a big vein right there.
The first step is to take the second of the two masses out. And the first thing that I would do in this situation is just what he's doing, is I would cut very superficially around it to take a look at the blood supply. And the key is to cut little by little by little to prevent excessive bleeding from happening.
All right, last little piece now. Here it comes. There we go.
Wow, isn't that satisfying? I mean, as a surgeon, taking something like that off, there's almost nothing more satisfying than doing something like that.
This is an unroofing of the nose beneath the mountain of tumor. And you've got to be careful not to remove the normal parts of the nose.
Unfortunately, it's not so simple as just to cut off a bridge between that second mass, the one closest to his nose, and his actual nasal tissue. As you can see, it looks like hamburger meat. I mean, it's all beat up. There are rhinophymatous masses all around it. This is not a simple operation.
There we go. It's just the skin.
So now we progress to the third stage of this operation. Number one being the tracheostomy, number two being removal of these masses, to the number three, which is reconstructing his nose and trying to make it look as natural as possible.
We're able to get it off pretty well without losing a lot of blood, but this is not really a nose under here. This is really just almost like hamburger meat.
Now, what you're seeing there is a bunch of extra tissue on top of the actual nasal cartilage and the nasal skin, essentially thickening of that skin. And so the next step would be to literally whittle away, almost like you're a sculptor with clay, that excess tissue to get as normal looking of a nose as possible for Roger.
Some of this was the rhinophyma, but some of it's the normal ala, which you can see here on the inside, is just stretched out to maybe, 4 or 5 times its normal size.
In this situation, because the nostril has been so stretched out, you need to do what's called an alar-based resection, where you actually cut a portion of that ala out and then stitch it back into place. This is done in a much smaller fashion in ordinary nose jobs as well.
This is your portobello mushroom, and that was my Idaho russet.
That's right.
It sort of looks like when you cut through a scallop, actually. It's got that kind of whitish look, and it's sort of that rubbery texture when you feel it.
Everything in surgery comes back to food. When we're in the operating room, what do we talk about? We talk about food. When we take growths off of the body, what do we talk about? We talk about what food these growths look like. And you gotta admit, she's on target. That one does look like an Idaho russet potato.
Last time I saw Dr. Lee 2 months ago, my whole life has changed. And now that I have it fixed, I could do the normal things like eating, drinking, and sleeping. And I'm happy. I want to just go out there in the street and show myself.
Hey, it's about time you got here. About time.
That is just incredible. Kudos to Dr. Lee and her facial plastic surgeon colleagues for doing an incredible job with Roger's nose. Now, he's only 2 months after surgery. Things are still swollen, they're still healing. They're actually gonna look much better as time goes on, so I'm really happy for him. Do you love watching Dr. Sandra Lee take these huge growths off of people? Well, if you do, take a peek at this playlist right up here where I react to numerous episodes of Dr. Pimple Popper. These will gross you out, they will astound you, and they will definitely entertain you. And if you've been enjoying my videos, please subscribe to my channel, and always remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.